When mixing alcohol and antibiotics, you might not notice a difference in their effectiveness. However, you are at risk of experiencing unwanted side effects. Additionally, it can weaken your immune system. Some people wonder whether alcohol and antibiotics can be consumed simultaneously. Alcohol should be avoided if you're taking prescribed antibiotics for any reason. Drinking alcohol in cases where you're on antibiotics can lead to some unpleasant side effects. Understanding how those two substances collide and what to expect will help you avoid the negative symptoms. So, what are antibiotics and what do they do? Antibiotics stop infections and generate recovery because they kill bacteria or prevent them from reproducing. Before the introduction of antibiotics, it was common for people to die from what we see as minor infections today. Some of these infections that antibiotics treat include sinus infections, skin, bladder, and kidney infections, whooping cough, and strep throat. Antibiotics cannot be taken for illnesses, like the flu or COVID-19. There are tests that can determine if an illness is bacterial and needs antibiotics, or a virus and doesn't need prescription antibiotics. Despite being used regularly to treat bacterial infections, antibiotics can have some side effects, such as vomiting, diarrhea, bloating, and abdominal pain. Antibiotics are used because they are effective at killing bacteria that cause these conditions. As antibiotic resistance has become a major problem, it's been difficult for us to find effective medicines that actually work. Overuse of antibiotics has led to bacteria adapting, making them resistant to these medicines. Today, most prescription antibiotics are no longer used for infections of the chest and ear or sore throats. Now, how does alcohol affect antibiotics? Mixing alcohol and antibiotics is a bad idea because it will nullify some of the effects of the antibiotic. There are different types of antibiotics that react differently to alcohol, so be sure to speak with your doctor before consuming any type of alcoholic beverage while taking antibiotics. Depending on the type of antibiotic, mixing it with alcohol could cause liver damage, vomiting and nausea, quick heartbeat, seizures, and worsening of antibiotic use side effects. The interaction between antibiotics and alcohol will depend on the medication you're taking, so before starting a round of antibiotics, it's important to talk with your doctor about your prescription. The idea that alcohol makes antibiotics less effective is a myth that dates back to the days when doctors prescribed wine as a remedy for everything. Mixing alcohol and antibiotics is a bad idea because it will nullify some of the effects of the antibiotic. There are different types of antibiotics that react differently to alcohol, so be sure to speak with your doctor before consuming any type of alcoholic beverage while taking antibiotics. Depending on the type of antibiotic, mixing it with alcohol could cause liver damage, vomiting and nausea, quick heartbeat, seizures, and worsening of antibiotic use side effects. The interaction between antibiotics and alcohol will depend on the medication you're taking, so before starting a round of antibiotics, it's important to talk with your doctor about your prescription. The idea that alcohol makes antibiotics less effective is a myth that dates back to the days when doctors prescribed wine as a remedy for everything. Though the origin of this myth has been debated for decades, it seems that one possible explanation is that doctors told their patients to abstain from alcohol to prevent them from spreading antibiotic-resistant STDs in 1950s America, since antibiotics were starting to be used as a treatment for various STDs type. The myth of taking alcohol with antibiotics is one that's pervasive in the minds of most people, but for most antibiotics, it's simply a myth. Alcohol doesn't typically affect the potency of antibiotics, but it can inhibit an antibiotic's effectiveness for other reasons. Drinking alcohol when you're on antibiotics might affect the antibiotic's effectiveness, so it's wise to be cautious. Alcohol can cause problems with your immune system as it suppresses it. Alcohol and antibiotics are not safe to mix. These two drugs together can lead to some very unpleasant side effects, including a flushing of the skin, low blood pressure, and vomiting. These reactions occur even if only a small amount of alcohol is consumed. A few types of antibiotics, including metronidazole, isoniazid, trimethoprim, and sulfamethoxazole, shouldn't be used with alcohol. These specific drugs interact with alcohol, leading to a buildup of acetaldehyde, an alcohol component, in the liver. This buildup is what causes many hangover symptoms. Flucloxacillin, which is an antibiotic that can have an impact on the liver, has been shown to make the liver work harder and can even lead to liver infection. Alcohol's interactions with antibiotics are tricky. In most cases, they don't interact at all. However, alcohol and antibiotics together can lead to increased side effects. Also, while alcohol and certain types of antibiotics may not render your medication ineffective, they can make your symptoms worse and weaken your immune system. Neither of these is good if you're dealing with a bacterial infection. But, how can I take antibiotics? Drinking while on antibiotics isn't recommended and can be dangerous. Drinking alcohol while on antibiotics will usually not impact their effectiveness, but combining the two substances can lead to unpleasant side effects. Alcohol also weakens your immune system, which won't help your body fight off bacterial infections. Before starting a round of antibiotics, speak to your doctor about any alcohol habits you may have. If you find yourself struggling with alcohol use, you can get help. Contact us today and we'll discuss treatment options that will help you to recover and live a healthy life without alcohol. Was this helpful? Like, share, and subscribe to our channel.